Hi everyone, and welcome to this introduction to the Academy of Pharmaceutical Sciences Advanced Therapy Medicinal Products Focus Group. Oh no, I've messed up already. I'll start again. Hi everyone, welcome to this introductory video on the Advanced Therapy Medicinal Products and Biologics Focus Group. So my name is Zara Rattray from the University of Strathclyde, and I co-lead this focus group with my colleague
Chris Vanderwall. Pleased to meet you all.
So Chris, do you want to give us a bit of an overview about ATMPs and what they are?
Yes, thanks, Zara. So hello everyone, my name's Chris Vanderwall. I'm in the Cell and Gene Therapy Catapult, and we have a new laboratory up in Edinburgh, as well as 3 sites around London, Braintree, Essex and Stevenage. So ATMPs have a regulatory meaning. They are not the same as advanced therapies, and they are the future, right? You can't deny that, I'm afraid. All cell therapies and gene therapies will certainly, as already are, enter the market and increase in the years to come. So in terms of the definition then, a gene therapy generally will involve something like an adeno-associated virus. We could also involve things like lentiviral systems, which might change a T cell, and T cells you might be aware of are things like Kymriah and Yescarta. So in addition to adeno-associated virus and T cells, we have somatic cells that are substantially changed once they are taken from the body as a tissue, so it could be a blood or tissue sample, and then genetically engineered, or they might be derived from induced pluripotent stem cells or human embryonic stem cells sometimes. And the final category are tissue engineered products, and these are much more advanced because they'll be, for example, a cell in condition with a hydrogel-like scaffold. So those are the 3 examples, and they all are subjects of study, both in academia here at the Cell and Gene Therapy Catapult and, of course, in industry. If you want to find out more, then I suggest you look at Casgevy. That's made in Scotland, not that I'm being biased, but that's the first CRISPR therapeutic, so it's a very important milestone for the UK. It was the MHRA first approved that before FDA and EMA. And then you've got some of the gene therapies, of which there are now quite a few. So please go on to Google. It's always a good start. Type in ATMP, gene therapies and cell therapies, and browse away. And I'm sure Zara and I are always here. If you're interested, please do just email, text, whatever. I might not be a social media. That was better for me. So I'll leave it to that. Thank you.
No, thank you very much for the introduction there. So as my colleague Chris, who co-chairs the focus group, mentioned, he's referred to what ATMPs are. And now I'm going to talk a little bit more about what do we do as a focus group and who are we. So we are pretty much interested in the development, the manufacture, regulation and use of advanced therapy medicinal products and biologics. So what this means is a group of people from different sectors, so academia, industry, the catapults and regulatory bodies. And we are very much interested in how the cross-section of these different sectors come together to enable the clinical and commercial translation of advanced therapy medicinal products as drug products. So very interdisciplinary, very intersector and very mixed. And what this brings with it is obviously an environment where we can talk about advanced therapy medicinal products and where we can actually shape and develop new collaborations within the UK pharmaceutical sciences community. And off the back of this, we've hosted a series of events recently where we have interviewed key opinion leaders within the field from different sectors and looked at the intersection of the ATMP community. So if you like what you've heard from us today, don't be a stranger, you know where to find us. You can contact us and join the ATMP group. We're always looking for new people to join the group, new minds. And if you're shy and you don't necessarily want to take on an active role, please let us know what types of events and information from the group may be useful to you. And we're more than happy to help and arrange these types of events. So we look forward to meeting some of you and join our group because we're the coolest and the best group.
Of course.
Yes. Thanks, everyone.
Thank you very much. Thank you, Zara.
Thanks. So I'll just stop recording.